Thank you very much, Dr. Nikhil. Thank you, Dr. Amol, for giving me this invitation. Today, what I'll be speaking to you on, next slide, first line Pembrolizumab, next slide. We know that phase 3 keynote 407 study was a study of first line Pembrolizumab plus carboplatinum with taxanes. Taxane could be paclitaxel or NAP. Paclitaxel was given weekly, whereas paclitaxel was given 3 weekly, versus placebo plus same chemo arm. A protocol specified final analysis, that is at a median follow-up time of 14.3 months, there was a clear improvement in median OS of 17.11 versus 11.6 months with a hazard ratio of 7.1. So there was a clear-cut difference in the improvement of overall survival and PFS when we use Pembro plus platinum plus taxane versus placebo plus chemo in this keynote 407 trial. Today, what I'll be speaking to you will be a 3 years, that is the long-term follow-up of these patients in the intent to treat population, and what is the outcome of those patients who had completed the 35 cycles of Pembro. Next slide. This is a study schema of keynote 407. This was the pre-eligibility criteria for untreated stage 4 squamous cell carcinoma with a good performance status. You should have a sample, but it was not necessary to have a PD-L1 expression. The provision had to be there for a sample, and asymptomatic brain mets were allowed. This was a direct randomization 1:1 between Pembro plus carbo and taxane, pacli or NAP for 4 cycles, followed by Pembro as maintenance up to 31. So that comes 35 cycles, 4 cycles here of Pembro, and then 31 cycles of this. And in the experiment, in the study arm, this was the study arm, and in the this was the study arm. In this arm, it was a placebo plus carbo plus pacli or NAM, same chemo basically, and placebo was given as a follow-up. This 1:1 randomization was stratified as per the PD-L1 expression, TPS score less than 1 or more than 1, and the choice of taxane, whether it is pacli plus, and the geographic region. The primary endpoint of this study was PFS and overall survival, and the secondary endpoint was overall response rate and duration of response. Next slide. So approximately 560 patients were roughly equally allocated to Pembro plus chemo versus placebo plus chemo, and as you can see here, 55%, that is 19.8% of the patients completed 55 cycles of Pembrolizumab, versus in the placebo it was only 1.4%. Of those 55 patients who completed the 35 cycles of chemo, 7 patients initiated a second response from chemo. As we can see here, in the placebo arm, it was allowed to be on the crossover to Pembro. So there was 117 patients crossed over from the placebo arm to single agent Pembrolizumab. Approximately 26 patients received some other forms of PD-L1 and were out of study. So there was a crossover of 51.1% from placebo to Pembro arm. The median range from time from randomization to cutoff now was 40.1 months, more than 3 years. Next slide. This is the baseline characteristics of the patients who were in the study, and as you can see, most of them were above the age of 65 years. Most of them were males, approximately 80% of males, and even those patients who completed 35 cycles of Pembro also, is nearly equivalent. Most of them, 90%, were current smokers. Only thing that we find a little difference here is PD-L1 expression more than 1% was around 60% in most of the patients in the trial group, the study group. And in our patients, whom we are going to talk today on those 35 cycles of Pembro, those who completed, the PD-L1 expression was slightly high, 74.5%. Next slide. And as we can see, the median overall survival was 17.2 months in the patients who received Pembrolizumab versus 11.6 months. And at 3 years, that 36 months, if you can see, the 29.7% of the patients who received Pembrolizumab were alive compared to 18.2% who were on the placebo. Next slide. As far as the PFS is concerned, we can see the median PFS was again 8.1 versus 5.1 with a hazard ratio of 0.59. And at the data cutoff, not a data cutoff, at 36 months, that is at 3 years, it was the Pembro arm did much better than the placebo arm, 16.1 versus 6.5%. So PFS was also better. at 3 years, as well as the overall survival when the Pembro was used. Now, PFS2 was basically from time from randomization to disease progression on second line therapy. And this was also, this is the objective response rates, what we see here. The objective response rates were also, as you can see, in the Pembro arm was around more than 60% stable disease, that means partial response versus complete response. And here also we can see in the placebo arm, it was far inferior than the Pembro arm. The progressive disease was 6.1 versus 14.2 in the placebo arm. Duration of response, as expected, was much better in the Pembro versus the placebo. Next slide. Now, if we do the overall survival and PFS, and if we stratify as per the PD-L1 status, TPS score more than 1 versus less than 1, in the Pembro plus chemo arm, the median overall survival was 18.7 months versus in the placebo, it was 12.8 months. With the next slide, please. Hello? Previous slide. Hello? Can you hear me? Yeah. So, in my screen, it is not coming. But anyway, and the TPS score, with a TPS score of more than 1, the overall survival was 18.7 months versus in the PDL TPS score less than 1, it was 15 in the Pembro. And the basic thing here, what we have to see is that irrespective of TPS, the overall survival and the PFS survival was much better. And even in the 3 years rate follow-up, irrespective of PDL TPS score, it was better. The overall survival and the PFS were better. Next slide. So now we come to those patients who had completed 35 cycles of pembrolizumab. In those patients who had completed 35 cycles of pembrolizumab, approximately 51% of the patient had a response. And if you see here, there were no patients with progressive disease. So out of these 55 patients, 93% of the patients continued to have a good response. The duration of response has not been reached. And 1 year after completion of these 55 cycles, if you can see, 96% of the patient continued to have an improved overall survival, and 82 had a PFS of 82.6% at 1 year after stopping the 35 cycles of chemotherapy. 7 patients who had recurred took the second course of pembrolizumab, of which only 1% was lost. Next slide. You see the adverse events here? There were no really major change in the adverse events. If you see, only 1 patient here, as you can see, in the patients who had completed 35 cycles of Pembro, had a grade 3 event. Next slide. So to conclude, with a 3 years follow-up, pembrolizumab plus carboplatinum, and actually that is the triplet of Pembro plus carbo and taxanes, continued to show overall and PFS benefit, and this was irrespective of PD-L1 expression. Most of the patients who completed 35 cycles of chemotherapy saw continued to show a good response and good remission. 92.7% continued to be in good remission. Pembrolizumab plus chemotherapy, we saw had a good safety profile. Only 1 patient over a period of 35 cycles had a grade 3 toxicity. So Pembro plus carbo versus and Pacli is a new standard of care for all first-line treatment of metastatic squamous cell carcinoma, regardless of PD-L1 expression. Thank you very much for your hearing. Sorry for the slag in between.